My name's Gemma and I'm a speech and language therapist. This course has been written by NHS speech and language therapists and it's been designed to help you understand more about speech sound development and how you can help your child. So this course is for parents who've been sent this video to get a better understanding of how to help their child with speech sounds. And this video could also be for anyone who's helping children with speech sounds or anyone who's interested in speech and language therapy. So our aims for today's course are to look at how we make sounds, to look at the development of speech sounds, to work out what's happening when children don't use the right speech sounds, and also to look at ways that you can help your child and so that you know what to expect from speech and language therapy sessions. So first, let's talk about what we need to make speech sounds. This is really important to understand because we use all of these parts of our body when we speak. So when children have speech and language therapy, we might be teaching them how to use these different parts of their body differently to make the correct sound. So as you can see on this picture, there are lots of different areas of the body that are really important when we make sounds. We need our brain. First of all, our brain is going to decide what exactly we want to say and then send messages to all the other parts of our body to get everything ready to make the sound. The lungs are needed in speech to help get air up to our voice box and into our mouth to make the sound. Our voice box is in our throats and it can help to make sounds loud or quiet. If you put your hand on your throat, you'll be able to feel it buzzing while you talk. So we can either make air go through our mouth or out through our nose to make different sounds when we talk. And we also use our teeth, our tongue, our lips and our whole mouth shape to help shape the air to create different sounds. Our ears then listen to what sound we've made and pass that message on to our brain. So there are three main places that we make sounds in our mouth. The first place is with our lips, so for p or b, it's our lips that move. The next place is we put our tongue behind our teeth, so if we do a s sound. And then the third main place is at the back of our throat, so if we say g, that sound is made at the back. Your speech and language therapist might get your child to practice doing long sounds like s or short sounds like p. We've got a sound activity in the description box, so pause the video now and have a go at the activity. So there are lots of different ways that children can struggle with speech sounds. Some children will need help making the right shape with their mouths. Some children will be able to make all of the shapes, but they'll need help coordinating to get all of the shapes in the right order as they're talking. Some children have the words stored with the wrong sound in their brain, and so they'll need speech and language therapy to help them store that sound right. So your speech and language therapist will carry out some assessment with your child and they'll help determine exactly what the difficulties are with the speech sounds. Next, we're going to talk about how sounds develop. Children learn to use speech sounds gradually. They won't get all of the sounds right in all of the words all of the time. There are stages that younger children go through where they use the wrong sound, and that's okay. Some sounds are much harder than others, so they develop later. This picture shows what age we think your child should be to develop certain sounds. As you can see, some children won't learn the later sounds until they're around 5. Some children will need help to make sure that they've got the right sound with the right word. As we said before, we've got to make sure that they've got that sound stored correctly in their brain. So here are some of the common mistakes that children make with speech sounds when they're younger. So all of the mistakes in the table are ones that we'd expect children to use when they're younger, and then we'd expect them to grow out of it. If they haven't grown out of it by a certain age, then they can have speech and language therapy to help them to use the right sound. You might want to pause the video here, have a look at this table, and see if you can recognise any of the common mistakes or any patterns that your child uses in their speech. Now, some of the error patterns that children might use aren't in this table. Some children use their own patterns which don't occur in typical speech development. So for example, your child might say gore instead of door, or they might say ha instead of car. So in the next part of the video, we're going to talk about how we work on speech sounds and what you can do to help your child. Children have to learn to make sounds in small steps. New sounds can feel really different and unnatural to them, so they need lots and lots of practice to get them just right. Try making a S sound. Have a feel in your mouth and see where you put your tongue. Do you put it on your top teeth or your bottom teeth? S. Now try doing it with it swapped around the other way. S. It feels strange. This is what it will feel like for your child at first when they're learning to do new sounds. They might be putting their tongue and different parts of their mouth in different places, and that all needs practice. It's really important before starting therapy that we know children have got good attention and listening skills so that they can get the most out of the sessions. We talked about this pyramid in our talk time video. As you can see, speech sounds are at the top of the pyramid. That means that all of the other skills need to be in place first before we can work on speech sound skills. Another thing that's really important is that children are able to hear the difference between the sounds before we start working on making them. So, therapy will include activities where they have to listen for the different sounds. This picture shows all of the small steps that speech and language therapists need to take to help teach children to say a new sound. As you can see, there are lots of different steps, and it's really important that you don't skip any steps. So the first thing that we start with is being able to produce the sound on its own. Some children will be able to do this really easily, and this might be the point when some children need a lot more practice. Once they're able to say it on its own, then we move up a step and get them to say it with a vowel sound. There are lots of different vowel sounds, not just A, E, I, O and U. So the speech and language therapist will use picture cards to show your child which sound they want them to make. So as you can see, there are lots of steps that we have to take in speech therapy to make sure the child can say it in conversation. So let's talk about what you need to do when you come for speech and language therapy. Please come to all the sessions that we offer you. And if you're not able to make it to your sessions, please let us know. We've got lots of children waiting for speech and language therapy. Your speech therapist might ask you to do some homework in between the sessions. With speech sounds, this is really, really important that you do this. Practicing speech sounds little and often is always best. So try and find at least 10 minutes of your day where you can practice with your child. It's worth remembering that progress can seem quite slow at times. Each child will work at their own speed, and sometimes the practice can be really hard work for them. That's why it's best to keep the sessions short. So, what can you do to help? The first thing is, if your child makes a mistake in their talking, say the sentence back to them with the correct wording. Speech therapists call this recasting, and it's really important. So if your child says, "Oh, look, a guck," when they're pointing at a duck, you can say, "Oh, yes, a duck," and then try and put some emphasis and stress on the part of the word that they've got wrong. In this case, it's a gut instead of a duh. So making sure that you say, "Oh, duck." You can repeat this lots so that they get to hear the right sound in the word. Try and avoid putting pressure on your child to repeat the words or say the words correctly. This isn't going to help them to use the sound properly, and as you saw previously, there are so many steps that need to be in place for a child to use the sound. And another thing that you can try and use is some signing. We've got a signing video on our channel that might be useful for you to learn some early signs to use with your child. This can really help to decrease your child's frustration when they want to get their message across and when they can't be understood. So let's talk now about what you can do when you can't understand your child. We know that this can be really difficult and quite frustrating both for you and your child, so try and be as patient as you can. Go back and repeat part of the message that you did understand so that your child doesn't have to say the whole thing all over again. So, for example, you could say, "Mummy said what?" or "Where are we going?" You can ask them to tell you more about it, or to show you, to take you to what they're talking about, show you a picture. You can encourage your child to use a gesture to show you more, so it might be car or blocks, anything that might help you to understand what they're saying. Once you think that you've grasped what your child is saying, repeat it back to them so that they can hear the right sounds. I'd be quite mindful about pretending to understand your child. Try and use phrases instead like, "Oh, I'm sorry, I need to listen again. What did you say?" Or, "Was it this or was it that you wanted?" Another thing that can be really helpful if your child goes to school or nursery is to set up a homeschool book so that you know what they've been doing during the day and what they might be trying to tell you about. So the last thing that we're going to talk about is some common misconceptions, some myths that some people believe that are not true. So one of these is that tongue exercises and chewing help speech. This does not work. Another thing that some people might say is that their child is lazy. This isn't true. Some more things that people might think are that if children are able to say the sound, then they should be able to use it in words. And we know that this isn't true. They have to go through all of those steps to be able to say the sounds in words. Some people think that letters and sounds are the same thing, and that telling children to say it again will help them to say it, which it doesn't. It's really important to remember and to keep in mind that if children could speak more clearly, then they probably would. After all, life is so much more simple when people can understand you. I hope that you found this video useful and that you've learnt some new things about speech sounds and speech sound development. Have a look in the description box below for more information. Thank you, bye!